Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. The last couple of days we were talking about fronto temporal degeneration, one of the other types of dementia beyond Alzheimer's disease that some people run into. It's also a type of dementia that frequently doesn't get diagnosed for a long time, mainly because people think about dementia and they think about memory loss. And with FTD, there's often not as much memory loss until the disease progresses a bit. It's a great example of how the way that the brain is changing internally, it shows up outwardly as different types of behavioral changes. Alzheimer's disease affects the memory center first, so you see memory changes first. When it comes to FTD, that's not what happens. You get frontal lobe impairment instead. Well, another type of dementia that I want to talk to you about is called Lewy Body Dementia. Lewy Body Dementia, as a term, refers to both dementia with Lewy bodies and Parkinson's dementia. How's that for confusing? Parkinson's dementia and dementia with Lewy bodies look basically the same under the microscope. Both of them involve a buildup of proteins called Lewy bodies, named after Dr. Friedrich Lewy, who discovered them. In fact, he discovered them working in the same lab as Dr. Alzheimer. Now, as Lewy bodies build up in the brainstem, they cause a depletion of dopamine, and that affects movement. It also can affect cognition. And when it comes to Parkinson's dementia, usually people have Parkinson's disease type symptoms first, movement disorder, and then they develop dementia symptoms later on. In dementia with Lewy bodies, people tend to have the dementia symptoms first, and then Parkinsonism shows up later. Well, let's talk through dementia with Lewy bodies a little bit and some of the things that you might see. There are some really core features to the disease, things that typically happen. And the first one to understand and look for is a highly variable cognitive level. When you're dealing with Lewy body dementia, people can have a lot of mental clarity one day and be totally confused the next. They might have a good morning and be really different in the afternoon. And it's not that that can't show up in other types of dementia, where many different things affect cognitive functioning, but it's typical with Lewy body dementia that it's like riding a roller coaster, and that is painfully difficult for everybody involved. If someone's memory functions better and it's kind of a random occurrence, you really don't know when you can sort of improvise and give a plausible reason why something might be happening versus when you need to stick to the absolute truth of exactly what happened. That's a stress on anybody. Now, there are other symptoms of Lewy body dementia. One of the most common things is REM sleep behavior disorder, and that often shows up years before the disease actually gets diagnosed. Normally, when we're asleep and we're dreaming, we're kind of in a comatose state. We don't move, even though we might be dreaming about running. But in REM sleep behavior disorder, you actually are acting out dreams. You're moving when you're dreaming about running. That's not a good symptom to have, and it can be a sign that things are off in the distance, but we're approaching them. Another major feature of Lewy body dementia is complex, well-formed visual hallucinations. It's common for people to see things like squirrels running across the room or people who aren't actually there. And if what people are seeing is not distressing to them, we don't need to get too distressed about it. We can just sort of improvise and go with it and comment on the things that they've seen and listen to what they're describing. People with Lewy body dementia also tend to spontaneously exhibit symptoms of Parkinson's disease, especially rigidity. Usually when people think about Parkinson's, they think about the tremoring that shows up in the extremities. But it's also very common that people will become stiff and rigid. They don't move as fluidly as they used to. They might try to move, and it's like they have gum on their shoes. And that sort of stiffness and rigidity in their muscle movements is typically something that you see in Lewy body dementia. It just comes and goes. There are other symptoms that tend to show up in Lewy body dementia, but they're a little less common than some of the things I mentioned. Things like severe sensitivity to antipsychotic medication. One of the reasons why having a proper diagnosis is really important is that you have someone who's seeing things that aren't actually there, And you might see a justifiable reason to give them an antipsychotic medication. And yet a lot of people with Lewy body dementia are very susceptible to that medication, and they have really negative side effects. Like they can develop a condition called neuroleptic malignant syndrome, where their body starts breaking down muscle tissues, and that wrecks the kidneys, and they die a nasty, awful, ugly death. If someone is extremely sensitive to antipsychotics, and they develop a lot of movement disorder when they take the antipsychotic, that might be a symptom of Lewy body dementia. People with Lewy body dementia also frequently experience fainting spells, and they might be unresponsive for periods of time. And that's really transient. It just comes and goes. It's not a consistent type of thing. And often these people will go off to the emergency room after they pass out, and the doctors won't find anything going on, and they'll just label it syncope, which is a fancy way of saying, well, they just fainted. Frequently, people with Lewy body dementia have constipation, or they have orthostatic hypotension, where they stand up and their blood pressure just drops. That makes them more likely to fall, and so they often have repeated falls as well. And they frequently also have apathy, or anxiety, or depression, or other mental health kinds of symptoms. I hope this review of the symptoms of Lewy body dementia helps you to be a little bit more aware of the kinds of things that you might see. Not everybody has Alzheimer's disease or vascular dementia, even though they're two of the most common things that show up. And the more tuned in we are to other things that might show up, the more we can start understanding what's changing, and we can be thoughtful about ways to approach people based on those changes. Well, I hope this is helpful to you and the people you serve, and I look forward to seeing you again tomorrow for another episode of the Caregiver Minute.